So today we are going to talk about the chiropractic care for chronic pain, particularly spinal manipulation and neurophysiological modulation. Chiropractic care, particularly spinal manipulation therapy, or typically called SMT, is widely used alternative and complementary intervention for musculoskeletal pain, especially chronic low back pain, neck pain, and tension type headaches, and some neuropathic conditions. Chiropractors use high velocity, low amplitude thrust and manual adjustment of the spine and the related structures with goal of improving spinal alignment, restoring joint function, and reducing pain. So you can see this manipulation is very good in bringing the results, and we will talk about the scientific fact in a minute. Recent advances in neuroscience and functional imaging have now begun to unravel the neurophysiological underpinnings of the chiropractic treatment, and particularly its impact on the central brain processing, somatosensory integration, and inflammatory modulation. When we think of biomechanical dysfunction and the pain generation, we know that musculoskeletal dysfunction such as vertebral subluxations, facet joint restrictions, myofascial trigger points, and altered spinal biomechanics can contribute to chronic nociceptive input and peripheral sensitization. This persistent input from dysfunctional spinal segments may lead to proprioceptive deconditioning and loss of joint position sense. It can also lead to abnormal afferent feedback to the central nervous system, and also activation of nociceptors and mechanoreceptors in the paraspinal tissues and ligaments. Spinal manipulations address these dysfunctions by restoring normal joint mobility, reducing local ischemia, and improving musculoskeletal kinematics, which in turn modulate the neurophysiological response to the pain. Next important part is segmental neuromodulation and spinal reflex regulation. So spinal manipulation has been shown to produce segmental neuromodulation, influencing both afferent and efferent signaling within the spinal cord. The somatosensory evoked potential studies, or SEP studies, indicate that chiropractic adjustment after sensory transmission and spinal excitability at segmental level is effective. The muscle spindle sensitivity and reflex excitability of the paraspinal muscles are also normalized post-adjustment and reducing spinal muscular hypertonicity and guarding. These effects result in decreased central sensitization and improved neuromotor control in patients with chronic pain syndromes. If we think of the supraspinal mechanisms and the pain matrix modulation with the chiropractic, we know that functional MRI and EEG studies have demonstrated that spinal manipulation also modulate brain activity in regions involved in pain processing and emotional regulation, and this include the areas like prefrontal cortex, particularly responsible for cognitive pain modulation, also anterior cingulate cortex, or ACC, which is responsible for emotional pain response, and insular cortex, which is responsible for interoception and intensity coding of the pain. In addition, it also has effect on the sensory motor cortex with effect on integration of proprioceptive and nociceptive input, which is responsible for pain. Adjustment of the spinal or other joint with chiropractic can enhance the sensory motor integration by resetting abnormal patterns of the afferent input, thereby facilitating cortical reorganization in chronic pain patients. I would now talk about the endogenous analgesia and the neurochemical changes which can happen with chiropractic. Chiropractic manipulation influences the release of the analgesic neurochemicals and anti-inflammatory mediators, and that include beta endorphins and enkephalins. Manipulation increases these endogenous opioids in both peripheral tissues and cerebrospinal fluid, leading to reduced pain perception. Second, there is also cortisol modulation. Spinal adjustment reduces the elevated cortisol levels, normalizing hypothalamo-pituitary axis activity and reducing stress-related pain amplification. There is also effect on dopamine and serotonin. Some studies report elevated level of these monoamines post-manipulation, which may enhance mood and affect the pain modulation. These neurochemical changes support chiropractic's role not just in structural correlation, but also systemic neuromodulation. Then I'm going to talk about the anti-inflammatory effects and immune signaling. Chronic pain is often accompanied by low-grade inflammatory state, characterized by elevated cytokines such as TNF-alpha, interleukin-6, and interleukin-1 beta. Chiropractic care has been shown to reduce the pro-inflammatory cytokines and oxidative stress markers. It is also shown to enhance the antioxidant enzyme suppression or expression, such as superoxide dismutase or SOD. And also it promotes the vagal tone, which is associated with cholinergic anti-inflammatory pathway response. These effects may attenuate both peripheral and central inflammation, contributing to the chronic pain, and hence it contributes to the pain relief. Then we can talk about the clinical evidence for the chiropractic in chronic pain. And numerous systematic reviews and clinical guidelines recognize the chiropractic SMT as an effective and safe option for several chronic pain conditions. The first one is chronic low back pain, and multiple randomized controlled trials and meta-analysis report significantly shown improvement in the pain and functional scores with outcomes comparable or superior to usual care and pharmacological interventions. The second is cervicogenic headaches or neck pains, where SMT chiropractic shows moderate quality evidence reducing headache frequency and neck disability index scores. The third part is osteoarthritis and fibromyalgia, where emerging evidence support the inclusion of chiropractic as part of multi-modal care in these conditions, particularly when myofascial components are involved, is beneficial. We can say that chiropractic as neurobiochemical modulator of chronic pain is usually very effective in majority of cases. And we have given a scientific evidence for its effect just now. Chiropractic care therefore offer more than structural alignment. It engages a complex array of neurophysiological and neurochemical pathways with the realignment, and that reset the dysfunctional spinal circuits and enhance the proprioceptive feedback. It also alters the cortisol representation and connectivity in the pain networks. And chiropractic is known to stimulate the endogenous opioid release and reduce neuroinflammation. We can say that integration of chiropractic into chronic pain care aligns the current paradigm, emphasizing multimodal, non-pharmacological, patient-centered approaches. And when these are combined with rehabilitation, psychosocial interventions, and lifestyle counseling, chiropractic care can provide a powerful tool for restoring the function and improving the quality of life in chronic pain sufferers. Thank you.